We've talked about a definition for loneliness, how to know specifically if you're lonely, and the fact that loneliness is very common in the US. Almost 1 in 2 adults are lonely. I showed you evidence that loneliness is deadly. It causes increased risk of premature death. Let's now look at what causes loneliness and what effect loneliness has on our health. Why we get lonely is understood as the loneliness regulatory loop. So we perceive social isolation. For whatever reason, we find ourselves in a situation where we're alone and we feel a desire for others. That's a feeling of threat that psychologists consider loneliness as the equivalent of physical pain. It's an emotional pain, loneliness. And this loop starts off with you notice that you're alone and you feel threatened by that. You feel unsafe. And that feeling of unsafeness leads you to become more vigilant. You feel like you're on the outside, and so you become more vigilant, looking for causes and potential other instances where you're left out. And so you start off just being alone, and that leads to this hypervigilance, feeling unsafe. And then you develop these cognitive biases. You are alone, you're isolated, but then you start to develop assumptions and biases that the world is threatening, that you're going to have, if you try to reach out to other people, you'll only be left with disappointment and rejection. That if somebody doesn't look up while you're passing by them and doesn't say hello to you when you walk past them, that's because of something you did. So even neutral social information gets reinterpreted in a negative light when you have that hypervigilant, looking for threat, looking for negative social interaction bias. And all of those cognitive biases that you then bring into your social interactions are actually self-fulfilling prophecies. So if you expect rejection, then you might be unwilling to open up or unwilling to reach out to others. And others will then perceive that you're not interested and not reach out to you. Or you might interpret how other people respond to you in a negative light, and that might, and you might act as if your negative assumptions about what they said or did are accurate, and your behavior might turn off their openness to connection with you. So by perceiving everybody as a threat and everybody as a potential source of rejection, you actually can influence the behavior of others and confirm your negative social expectations. That explains how an instance of loneliness can perpetuate into a cycle of thinking there's a threat and acting as if there's going to be a threat and causing others to then respond to you by confirming your negative expectations. The other side of the coin is, what is the effect of being lonely on health outcomes? So it's actually understood in the same theory with this hypervigilance for social threat. Let's say we are now on the lookout for another affront, another source of rejection, more people saying bad things about us. That actually compromises our ability to attend to things that require effort. So if we are preoccupied with threat, then we are less likely to, then our effortful attention processes become compromised. We're not able to sustain attention on difficult tasks. And this translates into less self-control. Self-control requires, in the face of desire, in the face of changing moods, continuing to do an activity that our executive function or higher cortices think is right. When we lose that self-control, we're less likely to engage in and sustain healthy behaviors. And this has been shown in epidemiologic studies. People who are lonely are more likely to smoke, abuse alcohol, not follow a physical activity regimen, eat an unhealthy diet. So self-care behaviors are affected negatively by the feelings of loneliness that lead to a drain on our ability to control our impulses. Another aspect of this loneliness is that another aspect of loneliness and that hypervigilance it causes is a greater arousal and a difficulty relaxing. And this actually translates into poor quality, less restorative sleep. And sleep has an enormous impact on overall health and the ability to prevent chronic disease and heal and maintain normal regulatory processes in the body. And finally, what this hypervigilance does is it activates our sympathetic nervous system. We perceive a threat in our social environment, and that kicks in our fight or flight stress response. That causes the release of cortisol and epinephrine. This graphic shows the effect of cortisol, but you can think of epinephrine as doing the same thing along with cortisol. So loneliness is activating this system, and this system in turn will have myriad negative health effects on our bodies. Cortisol and epinephrine increase blood sugar, which leads to insulin resistance, obesity, and diabetes. Cortisol and epinephrine increase our blood pressure, which leads to increased risk of heart attack and stroke. Cortisol and epinephrine lead to decreased serotonin, which leads to increased risk of anxiety and depression. And cortisol and epinephrine suppress the immune system, which leads to increased risk of infection. I've described here the mechanism whereby an instance of loneliness can perpetuate itself into a self-fulfilling prophecy of loneliness in the loneliness regulatory loop. I've also described the physiologic and the biologic and the health aspects and consequences of loneliness on the body and overall health.